A disability is something that has a major impact on your life.
Every disability is different.
And it's never the same thing for two people. I am blind in my right eye totally, and partially sighted in my left eye.
I was 18 years old. We were traveling way too fast on a gravel road. Broke my neck, my back.
My Asperger's syndrome and my cerebral palsy.
I have anxiety and depression. People would have no idea just talking to me.
Being independent means different things to different people.
I want to live in my own house. I want to pay my own bills.
Live independently and not rely on other people.
When someone is not able to live as independently as they can, it does have a detrimental effect on people's physical and mental well-being.
It's no complicated thing. It's just that people with disabilities want to be included.
Plenty of people get stuck in ruts when they feel like they can't overcome something in their life. That's where LIFTT comes in.
Living independently for today and tomorrow. LIFTT. We help people of all ages and all types of disabilities find the resources or acquire the skills to live as independently as possible.
We serve the southeastern 18 counties here at the Billings office. We have a variety of things that we offer. We can help with grant funding for adaptive equipment.
Maybe a home modification so they're able to access their home. We help people to find that funding.
Helping people apply for Social Security benefits.
Medicaid, Medicare, housing.
They have a peer support group. Peer support, I think, is key.
Sharing life experiences is one of the most powerful things to help people who might be new to disability, who might be struggling with their disability.
Youth transitions is kids that are transitioning out of high school. They need to learn those adulting skills. It might be rent an apartment, learn how to grocery shop, budgeting.
Help someone advocate for themselves in a school or an employment setting. One of our biggest strengths is providing folks with information and referral. If we can't help you, we hope to know who can.
A lot of times we'll have a potential consumer call in and they think that they just have one need, and it turns out that we end up finding 3 or 4 things we can actually do for them.
You can just come in and say, hey, I feel like I have this going on. Can you help me? And we can, which is so cool to me. I love that.
Most of us on staff at LIFTT have identified ourselves as having one or more disabilities. That is helpful in many cases.
It's easier to empathize with someone when you yourself have struggled with a disability.
This is what we specialize in. This is who we are, and this is what we do.
And it costs nothing to go to LIFTT. It's a nonprofit organization and they're there to help.
Somebody that was a consumer that was working with LIFTT was asked to do an art project. He visualized that the balloon helps to lift people up. And then it became the logo, and it's stuck.
There's been success on all kinds of levels.
It's really rewarding to have a consumer go, hey, I was able to do this by myself today.
We want people to live their best life as independent as possible.
Live as everyone else in society and live as a part of society, not apart from society.
Everybody needs help. Sometimes you just need a little more help, and that's okay. That's absolutely okay.
There's plenty of life to live still, and there's a way you can do it. Keep chipping away at it, little by little by little.
Knowledge is power. Let's share it, for crying out loud.
Send us an email, give us a call. We'll do our best to help.
We can definitely help figure out what your needs are and get started on that. We're one of many steps in the path to independence, and we're happy to be serving people here in the community.
Hello and welcome to Living Well in Montana, hosted by LIFTT, or Living Independently for Today and Tomorrow. LIFTT is a center for independent living that serves people in 18 counties in southeast Montana. My name is Eileen, and I am a health coach at LIFTT, and I help people with diabetes. I also do some brain health workshops. So lots of things health and wellness related is in my department. So I'm really excited to be here with Francisco, who wanted to share his story of turning the tide on diabetes. But before we jump into that, welcome, Francisco.
Well, thank you so much for giving me the chance to be here today and talk a little bit about my job and also my experience with diabetes.
Excellent. So let's start with what you do.
So I'm the Agriculture and Natural Resources Extension Agent serving Yellowstone County for MSU Extension. My work is right now focused on helping producers, farmers and ranchers with any topic related with their production systems. And that includes soil health, feed testing, water testing, soil testing, pest management, pest ID, plant ID, weed ID, a lot of stuff related with agriculture. Also for the community as well, we can help with urban pest control, pesticide safety, gardening, mental health, youth development. Other agents work with me at the office. So the office has 4 agents focusing on different programs. My case is agriculture, big operations. We have another agent, Anthony Samartano. He is the horticulture agent. Right. He oversees more related with landscaping, gardening, soil, etc. Erin Gregory, she is our FCS agent, Family and Consumer Sciences, and she can help people with health, state planning, food preservation, and health as well, and community projects. And also Ronnie Baker, she's our youth development and 4-H extension agent. She works with youth at the 4-H program.
Right, excellent.
Yes.
And so we're so excited to partner with you guys just for many projects. Erin has helped us with cooking classes, Anthony with our gardening workshops. And we have one coming up on Friday.
Yes.
That's a compost workshop that you guys seem excited to get the word out about.
Yes.
So
yes, we try to connect with different organizations across the county and help them with any particular need that the people has. We are here for serving the community, so we are very excited to help. And also we, as an extension agent, be part of the Montana State University. We can help to get access to different resources, a lot of information, on-based, research-based information, and also specialists. So we can contact them and ask for help.
Right, exactly. And the great thing is that you speak Spanish, so there's a lot of need in our community also for that. So
yes, we have a big population of Spanish speakers. So my goal, part of my job, is try to help people to connect with all the university resources, all the information we have, the services, and help the community. I speak Spanish. I'm from Costa Rica, so I'm fluent in Spanish. I'm still working on my English, but yes, I'm excited to connect with people across the county and help, and even across Montana. I can help other agents. I normally work with other agents too, and if they have a need, like a translation or interpretation or a workshop in Spanish, I definitely will go to that too.
That's wonderful.
Yes.
So again, with LIFTT too, if we have that same need, having that available is excellent. So yes. All right, and then on the workshop that you're doing, do you want to cover more of the details of workshops that you're
Well, yes, I just want to mention, as I mentioned, we try to cover different topics. So we will have some upcoming events. For example, we have a live cooking classes, I think tomorrow.
Yes.
You have a cooking classes.
Yep.
On March 11, we have estate planning, how to avoid provade. We will have summer food preservation series during the summer, so stay tuned. March 26, how plan your garden yield workshop, and also houseplant care on April 30th. From the gardening perspective, we have the seed swap on March 7th, 11 to 1:30 at the public library. Also, tree care workshop, that is in March 14th, 10 to 11:30. Caring for garden tools on April 8th at the library too. Master Gardener Symposium at the Carroll College campus on March 28th.
Wow.
And also how to, we have a 2 Moon Park Earth and Arbor Day on this coming spring. It's a volunteer event, so people can go and help and spread some seeds, take care of some trees, and help with the community. In my area, we are planning, we are going to communicate that we are planning a full day training for pesticide applicators, and they can come and get some recertification credits. Our cycle, Yellowstone County cycle, will end on December next year, in December 2027. So they need at least 6 credits to get renew their license. So we are providing more opportunities to get those credits. So that's part of the things that are coming, and we are getting ready for the growing season.
Yes.
So with this weather, there's a lot of things to work on,
Yes.
a lot of questions, and we are getting ready for the spring that is coming.
Right. So, and I'm guessing that you're on your website are all these classes?
Yes, and
that's
also you can contact the MSU Extension Office here in Yellowstone County. We are at 2320 3rd Avenue North. Our phone number is 406-256-2828, and you can call and contact us and ask more information related with these workshops and educational opportunities.
Excellent.
Yes.
Great. Wow. You've got a lot going on.
Yes. Yes.
That's excellent. So, and then you're going to do a workshop on Monday at LIFTT, because you also have a very interesting story of how you've turned the tide on diabetes.
Yes, so that is a workshop that we are going to do. I'm going to present how I deal with my diabetes right now. I recently got that diagnosed last year. Going to that, in my family, I have history of diabetes in both sides of my family. My grandma, my grandfather, my sister, my brother, aunts, uncles, so all the numbers.
Yeah.
So last year, after a trip that I had to Costa Rica to see my family, I came to Montana again, and I started having the symptoms of diabetes. I had a uncontrollable thirst, blurry vision. I had to go to the restroom a lot of times during the day because I was taking a lot of water, drinking a lot of water, and that feeling never disappeared at that time. I was tired, had problems to sleep, and I was gaining weight, and I was like feeling not so good. So I went to the doctor and I discovered that I had diabetes type 2 at that time. My fasting sugar, my fasting glucose level were around 350 in the mornings.
Wow.
Fasting.
Wow.
So we start talking about the disease as well, and how you can manage that, and which medication you can use and which medication you cannot use.
Right.
So I knew at that time that I was that consequence was because I was having bad habits in terms of food intake and health. I was very sedentary, and I was drinking different types of not healthy food and drinks. I based my diet on carbs and fast food, and because I was very busy, so I was trying to get something quick. and easy. So that was because I was having a bad habits of food intake.
Right.
So I start talking with the doctor and reading some medical research-based information, and I remember I told my doctor, I know this is the consequence of my habits in the last 2 years.
Right.
So we agreed, after a conversation, a serious conversation, we agreed to give me a time to make some changes. And if by the end of that changes, so that period of time, which was 4 months, my numbers were the same, we will go through an insulin regimen. So from that day to the next day, I just quit all my carbs intake, sugar intake, sodas, some other drinks, and I based my diet on protein and vegetables and salads, and start doing exercise. I start riding my bike again. I got an indoor bike on my house, and I start attending to the gym. And in those 3 months, I passed from 350 in the mornings to 90s and 100s, which is normal for a normal non-diabetic person.
Yes.
And that was just with a little of metformin. I was taking metformin. But most of that changes came from diet and exercise. So I lose weight, I get more energy during the day, better sleep, more energetic during the day.
Right.
And most important things, glucose level were down.
Right.
When I discovered, when I talked with my doctor and they gave me the diagnosis, my A1C was 10.1.
Wow.
And you need to be under 6.
Yes.
For a normal person. Right now, the last A1C that I got, it was 6.7.
Okay.
6.5.
So going in the right direction.
It's going to the normal rate.
Excellent.
And I discovered everybody reacts differently to different food. Right now, I'm very sensitive to carbs. So I know when I get some carbs, especially processed carbs, like wheat or flours or cookies, cakes or something like that, pizzas, pastas, my body reacts and then the sugar goes up really quick. But I learned how to control my intake, my food intake, and then get to a normal levels. Right now I'm having a normal life. It's just make research and learn and read about the information. Look for the right resources on base, scientific-based information.
Right.
Talk with the doctors.
Right.
Understand how the medication works. What kind of medication you need. To talk to them. They are there for listening to you too.
Exactly. Yes. And what an inspiration that will be for others to hear. And in the workshop, you'll be able to answer their questions, and because a lot of people we work with can be very frustrating of what's happening here.
Yes.
So to hear your story.
Because in my case, just the fact to go to use insulin and have to needle yourself twice a day or once a day, for me was kind of a turning point, right? When you think, okay, I need to do something because I don't want to be dependent. I know probably based on my family history that I could be on diabetes type 1, which is the immune chronic disease.
Correct.
Because I have that in my family. But I would like to postpone that as long as I really need it.
Yes.
That doesn't mean that if I need the insulin, I won't be use it. No, I will be use it if I need it. But at that time and right now, I discovered that with diet and exercise, you can control me. I can control that.
Yes, yes, and as we know, so many people are able to do that. So
yes, especially when you get in more years, getting older,
Yes.
it's easier to be more. It's easier to get into those problems.
Yeah,
Yes.
exactly. All right, so we're inviting anybody to come. It's a free workshop. It will be at LIFTT at 1241 Crawford Drive. You can just show up. It'll be great.
Yes, yes.
And
I will be sharing parts of the resources that I get from my doctor,
Excellent.
and also MSU has resources related. We have some one-pager or short articles or short documents that shows different topics. We call them month guides, and we have a month guide. It's called Getting Started with Diabetes.
Oh.
So it explains what is type 1, what is type 2, how the carbs act on your body,
Yes.
where you can find more information. So you can contact the extension office. I'm an agricultural engineer working on ag, but I am a diabetes person. And I went through this process where you discover what you have and how you can absorb that information and how to control some stuff on your normal life. I'm not a doctor, so I'm not going to give any advice. My only advice is go to your doctor, see your doctor, read, understand, ask.
Yes.
And that's the key.
Excellent. All right, well, we're going to change gears. We have kind of a treat. We have about 7 minutes left, and since Francisco speaks Spanish, vamos a hablar un poco en español.
Muy bien.
Entonces, si quieres otra vez habla sobre qué haces en MSU.
Yo vengo de Costa Rica, soy ingeniero agrónomo, trabajo con productores y ganaderos del condado de Yellowstone para la Universidad Estatal de Montana. Dentro de mis funciones está el control de plagas, identificación de malezas, identificación de enfermedades en cultivos. Ayudo a los productores con análisis de calidad de alimentos para animales, análisis de suelo, análisis de aguas. Básicamente cualquier pregunta o consulta que esté relacionada con agricultura. Dentro de las fincas con las que yo trabajo hay muchos trabajadores que vienen de diferentes partes de Latinoamérica y muchas veces esas personas quieren aprender acerca de cómo funcionan los plaguicidas o cómo hay que tener más seguridad en las fincas. Entonces yo puedo ayudarles con eso. Muchos de los recursos de la universidad en temas de información, documentos, están en inglés. Entonces puedo ayudarles a interpretar esos documentos y básicamente tratar de ayudarles a solventar cualquier necesidad que tengan. La universidad tiene un montón de recursos, somos 4 agentes. Yo estoy enfocado en grandes operaciones, grandes fincas, grandes operaciones ganaderas, pero tenemos un agente que se llama Anthony, que él trabaja en la parte de jardinería o en las huertas, en patios, parques, paisajismo, y nos puede ayudar también con identificación de plagas en las huertas, con la parte de suelos. O sea, nosotros los colaboramos mucho. Está Erin, ella es el Family and Consumer Science Agent, que es como el agente de familia y ciencias de los gastos, ¿verdad? Entonces ella les puede ayudar con presupuesto familiar, con planificación financiera, conservación de alimentos, salud mental, ese tipo de cosas. Sí. Y después está Ronnie Baker. Ella es la agente de 4H, que es el programa de 4Hs, que es un programa de desarrollo de la juventud. Y ella es la que se encarga de todo esto. Además, hay en la oficina 2 asistentes y un asistente del programa 4H que ayuda bastante. Pues nos queda poco tiempo para hablarles un poco de mi experiencia. Yo fui diagnosticado como diabético en enero del año pasado, en el 25. Y fui al doctor porque empecé a tener problemas de visión borrosa, mucha sed, iba muchas veces al baño porque tomaba mucha agua, empecé a ganar peso, muy sedentario, poca energía durante el día, Entonces decidí ir al doctor y fui diagnosticado como diabético tipo 1 al principio, después fue tipo 2 y la razón fue porque yo en ese momento hablé con el doctor y le expliqué que yo sabía que ese problema que tenía estaba basado en mi consumo de alimentos y mi régimen de actividad física en los últimos 2-3 años. Estaba muy sedentario y comía mucha comida rápida, muchos carbohidratos, algunas otras bebidas que tienen carbohidratos y azúcares. Entonces le pedí al doctor, después de una conversación seria que tuvimos, que me diera tiempo, que me diera unos 3-4 meses para cambiar algunos hábitos y ver cómo reaccionaba mi cuerpo. Y yo le dije que si en ese momento mi cuerpo seguía igual, yo iba a entrar al régimen de insulina, porque en mi familia tengo historial de diabetes. Mi abuela, mi abuelo, mi hermana, mi hermano, mis tíos, mis tías tienen diabetes. Entonces yo tengo todos los números para ser diabético. El doctor me dio la oportunidad y empecé. De un día para otro corté todos los consumos de carbohidratos, de azúcares, de otras bebidas energéticas y algunas otras bebidas. Y empecé a cambiar mi actividad física, empecé a hacer ejercicio, a usar mi bicicleta otra vez, a entrenar en la casa, a entrenar en el gimnasio. Y logré pasar de 350, las lecturas de glucosa en mi organismo eran 350 en las mañanas, a niveles normales de 100, 90 en las mañanas en ayunas, en 3 meses. Wow. Entonces, cambiando mi dieta y ejercicio, logré bajar los números y logré controlar. Aprendí que mi cuerpo es muy sensible a ciertos carbohidratos, específicamente procesados, y entonces trato de evitarlos. A veces sí voy y me como algo que pueda, y sé que mi organismo va a reaccionar de una manera y ya entendí qué hacer o qué tomar, hacer ejercicio, tomar más agua para lograr controlar ciertos niveles. Y bueno, pues el 23 de este mes tenemos un taller en LIFTT, donde yo voy a contar mi experiencia, voy a compartir un poco de información que tiene la universidad disponible y también un poco de lo que yo hice y cómo los números fueron cambiando a través de esos 3-4 meses. Es posible, no todos los cuerpos son iguales, no todos reaccionan igual. Algunas personas van a necesitar un tipo específico de medicamentos, llámese insulina, o otro específico, como el que tomo yo, que es la metformina. Pero vamos a hablar un poquito de eso, y a compartir un poco recursos de la universidad también.
Exacto. ¿Y es gratis? ¿Uno puede...?
Como parte de mi trabajo sirviendo a la comunidad, estoy muy, muy feliz de poder compartir mi experiencia y compartir información real, científica, basada en información, en investigación, para que las personas pues tengan más acceso y se acerquen más a los servicios de la universidad y los recursos que la universidad tiene.
Bueno, entonces vengan a escuchar esto. Y no tenemos más tiempo, entonces gracias para estar aquí.
Con mucho gusto. Thank you very much for inviting me today.
Yes.